coming to types of dislocation. It can be congenital or acquired. Broadly, it categorizes into two groups, congenital and acquired. Congenital means shoulder joint or whatever the joint get dislocated due to the congenital reasons. Means congenital reasons which predispose to laxity of the joint. So due to joint laxity, hyperlaxity of the joint get dislocated. It's a congenital, it's a genetical fact. Then coming to acquired. Most common type is traumatic due to any sort of trauma. It can be RTA, sports injury, or domestic injury. Joint get dislocated due to trauma. Then we goes to pathological dislocations. Pathological dislocation occurs when your joint capsule joint disrupted due to some other pathology. As example, if you get a tuberculosis or septic arthritis, due to these conditions, your joint capsule get disrupted, damaged. So due to this damage, joint can be dislocated. Another thing is paralytic. If you have any form of paralysis, maybe polio, cerebral palsy, or CVA, which leads to laxity of muscles surrounding tissues, so joint get dislocated. Then finally, due to inflammatory condition as rheumatoid arthritis, which disrupt the joint capsule, so joint get dislocated. Now you can see there are two types, congenital and acquired. And acquired, it can be traumatic, it can be pathological, it can be paralytic or inflammatory. Now we have to discuss symptoms of dislocations. A patient will come to you with a history of injury and he will complain pain in particular joint. He will complain swelling in that particular joint and surrounding area. And his main complaint will be inability to move his joint. There might or might not be numbness or paresthesia distal to the joint. So patient will come with these symptoms. Patient will give you history that there was a trauma, then he get the pain and swelling, and now he can't move the joint. And he will tell sometimes he get some paresthesia, numbness, inability to move the distal joints. So now you have to appreciate each of these symptoms, and now you have to see the signs. So once you look at the patient, you got the history. Now you look at the patient, you clearly see that joint is out of place. It's discontoured, misshapen joint, and joint mobility is limited. Once you ask patient to move the joint, either he can't completely move the joint or some limited movement is there. You can see the swelling around the joint or bruises, and if you ask patient to move or weight bear on that particular joint, patient will experience severe pain, and there might be decreased sensation distal to the joint, and you have to assess the vasculature. You have to see the distal pulse, you have to see the pulse pressure, pulse volume, and you have to compare with the normal side. You have to appreciate whether any coldness in the extremities, and you have to document all those findings. So you will see the discontoured joint, you will appreciate the limited movement and some swelling and intense pain when you ask patient to move, and there might be some distal neurovascular deficit. So